Infectious diseases today still pose a global threat to human health through both morbidity and mortality, especially in sub-Saharan Africa, where malaria still kills over 600,000 people annually, according to the WHO. Another infectious disease caused by viruses transmitted by the mosquito, dengue fever, is a leading cause of illness and death in the tropics and subtropics, with more than one-third of the entire world's population living in areas at risk of transmission. There are no vaccines to prevent infection with dengue virus. If one is infected, early recognition and prompt supportive treatment can substantially lower the risk of developing the severe disease.
Most of the time it's because we don't have diagnostics for it, and we have been making diagnoses mainly when there are only epidemics. But studies have shown that the prevalence is there throughout, and some studies showed probably even up to 46% of people have been infected with some of these viruses by the time they are adult. Even by the time they are 5 years, about 1% of the children have already been infected by dengue.
In a largely antiretroviral drug-naive populace, the HIV menace is an old adversary, with almost the entire population having been directly or indirectly affected by the scourge. Syphilis has been a subject of intrigue and controversy since it was first detected in the 15th century. Named the Great Imitator, it can manifest in a variety of symptoms depending on the host and stage of infection, therefore making diagnosis and management very difficult. HIV infection creates an additional layer of complexity. Both HIV and syphilis are both sexually transmitted, and the presence of one usually facilitates infection with the other. In addition, the diagnosis and management of syphilis differs slightly in HIV-infected and HIV-uninfected patients. The complex interplay between syphilis and HIV results in minor yet clinically relevant differences, especially in diagnosis. A blood test is the common way of detecting syphilis, HIV, dengue fever and malaria. Many strategies have been employed in the combat of these diseases, more importantly in the advent in technology for diagnosis.
The cornerstone in treatment is actually the diagnostic. Right diagnosis will save many lives, and wrong ones, I don't have to say what it means.
The diagnosis of this widespread and highly prevalent infections has received a boost with the launch of a new rapid diagnosis kit able to test 2 diseases at once. The new kits aim to simplify the testing process and are able to drastically reduce the time till the results show to as little as 15 minutes.
Is to be